The opioid crisis knows no bounds. The Centers for Disease Control and Prevention say more than 100 Americans die each day from opioid overdoses. In Alaska Native and American Indian communities, tribal leaders and public health workers are striving to curb abuse. It was a hot topic at the National Indian Health Board's annual Public Health Summit held in Albuquerque this week. NMIF correspondent Antonia Gonzalez sat down with the board's executive director and physician Ron Shaw to talk about public health in tribal communities.
Joining me now is Stacy Boland, the CEO of the National Indian Health Board, and Dr. Ron Shaw, past president of the Association of American Indian Physicians and CEO of Osage Nation Health Services. Welcome to New Mexico PBS. Stacy, go ahead and introduce yourself and tell us a little bit about your organization.
Okay. In my native language, Girjinakos, my name is Turtle Woman, and my Anglo name, of course, is Stacy Boland. I'm the CEO of the National Indian Health Board, which is the nation's organization created by the tribes, serving all 573 federally recognized tribes to improve healthcare delivery status, and uphold the sovereignty of tribal nations.
Thank you. And Dr. Shaw, please introduce yourself.
Well, I'm an internist and addictionist by training. I'm a physician and now an executive, chief executive officer at the Osage Nation Health Services, but I'm the immediate past president of the Association of American Indian Physicians, which is a national organization of over 400 American Indian physicians whose goal is to improve the medical well-being and improve the health of American Indians, and also to improve the number of American Indian health professionals in medical schools, schools of osteopathy. And currently my clinic is in north central Oklahoma on the Osage Reservation in Pawhuska, and I'm proud to be to preside over that operation. I'm glad you invited me here today.
Well, thank you. And you're here in Albuquerque for some national meetings, and one of the top issues being discussed is opioids in Indian country in the United States. And Dr. Shaw, can you just start with the basics? What are they used for, and then how does addiction develop?
Well, opiates or opioids. Opiates are naturally occurring drugs. Opioids may be synthetic or semi-synthetic, but the whole group usually is used to relieve pain, whether it be physical pain or musculoskeletal pain, all varieties of pain in the postoperative state as well as chronic. It acts at receptors within the brain, and that receptor physiology is very important in trying to understand the treatment and development of addiction. Opiate dependence has been defined in the past as a neurobiological disease embedded in a psychosocial context, in that there are a lot of social determinants of who's at risk of developing the disease, but once it's established and exhibits the pathophysiological behaviors, then the neurobiological abnormalities in the reward system of the brain are already established. And so now pharmacotherapy for opiate use disorder is now becoming a prominent part of therapy, not standalone therapy, but an important part of therapy to prevent relapse.
And Stacy, as we said, the meetings that are happening in Albuquerque, there are all kinds of health experts and leaders from across the country. You have also U.S. officials here, health officials at the conference that spoke. Tell us, how is this looking like in Indian country? President Trump had declared an emergency in the United States for opioids and also rolled out a plan. What's the plan for Indian country?
Well, there really wasn't a plan for Indian country. And yes, we have the Surgeon General of the United States spoke at our conference yesterday, and he focused a great deal on this issue, particularly with naloxone and the ability and the necessity to keep that on hand to prevent overdose death. And he talked a lot about that from a public health perspective. But for Indian country, many Americans don't understand that the relationship between the tribes and a government in the United States is the federal government. So when the opioid crisis was recognized and money was pushed out to address it, the money went to the states. But the tribes' relationship through treaties is not with the states. So none of that money reached the tribes. We had to go back to Congress and educate Congress and talk to our friends on Capitol Hill about the fact that The crisis is hitting Indian country harder than any other group in the United States. There's no funding available to us, so please help us. And we were able to get a small carve out of some dollars to help the tribes address this.
And Dr. Shaw, Stacy had mentioned how it's hitting Indian country hard. What are some of the things that you're seeing?
Well, substance use disorder, but particularly opiate use disorder, affects every facet of Native life, including parenting, its effects of exerting adverse childhood experiences on children that are in the household, as well as future employment, as well as incarceration. So it's all encompassing. So what we usually see is people presenting for treatment after a number of years of non-treatment who are typically in legal trouble or physical trouble, or finally, because of family pressure, they present for treatment. But time after time, I see these people starting with, my drug use began at age 12. Time and time again, you could almost rubber stamp that into their drug histories, that the drug use, maybe not drug dependence, started at somewhere around age 12. I keep hearing 12, 12, 12. So something about the exposure early on affects the development of the brain in the adolescent. So we see that. We see a lot of people who are overdosing, and so we've deployed naloxone as an overdose reversing agent. I think the claim to fame for naloxone is that it's been estimated that almost half of the fatal opiate overdose deaths are attended by an adult is usually present. I can't tell you how many of those are other using addicts. But if you've got that many available, try to equip them with naloxone so you can improve the chances of reversing a would-be fatal overdose by the administration of naloxone. And from 1996 to 2014, there were reported 26,000 reversals of an impending opiate overdose death. So that's a staggering amount, and that was early on before naloxone was really deployed and advertised. So that and medication-assisted treatment has been a substantial improvement in the treatment we have, because without that, the relapse rate's about 80% after standard psychosocial treatment.
And are we talking both prescription and non-prescription drugs?
Any and all opioids, prescription and or heroin in any form, whether it's snorted or injected.
And in some of these discussions, how are these getting into Indian country, whether they are prescription or non-prescription drugs?
Well, we know that the Indian Health Service has not had the saturation of training for its providers that is necessary to make sure that prescribing practices are in keeping with understanding and mitigating the opioid crisis. So they get in through prescription drugs, they get in through illegal means. Our communities are not special in the ways that they reach us. There's not a special way that they're reaching Indian country that's pretty common among communities.
And there's also discussions about laws. So how do federal, tribal, and state laws play into all of this?
Well, tribal law, obviously, when tribes have policy, those tribal policies are enforced by tribal governments. There are tribal public health laws that are put in place to try to protect against public health crises like this. And then once that happens, like any other government, then resources are put toward that, and other policies are made around ensuring that those things are supported. But I think that Dr. Shaw's discussion of medically assisted treatment and I would say also the availability of education to our tribal citizens and to the physicians who serve them, the nurse practitioners and others, should be such to ensure that they're used when really needed.
And are there some examples you could give of what you've seen as working? Maybe there's some programs or some policy or some work at a particular tribe that you're seeing that's working?
Well, I'm very envious of an operation up in Washington State, which has Medicaid expansion, which helps fund that operation. But it's a tribally operated medication-assisted treatment program that offers methadone, or other medication-assisted treatments, and it offers transportation. So to me, that's what we could all aspire to if we could treat everything. Part of the issues we all deal with is that methadone has to be through a federally licensed treatment program. You can't just open it up and order methadone to hand out. Even in the most structured environment, it requires a federal approval and license. So that's often difficult to get. I'd love to see legislation try to loosen those requirements so that other type of treatment, because there's no one type of medication-assisted treatment that's effective in all patients. Some people are better for the higher structure of methadone. Some do well with office-based primary care prescribed buprenorphine, which is also trade name Suboxone or Subutex, and some may be better with injectable naltrexone, which is long-acting, lasts about 30 days. So, ideally you would have all of those pharmacotherapies in your clinic. All of them could be prescribed by primary care.
And Stacey, when it comes to really any public health issue in Indian country, the community, tribes, or community members are really important in the discussion. So how can community members get involved in addressing this?
Well, I'd like to answer that a couple of ways. One of the things that I would like to make sure people know who are listening or watching is that this is hitting Indian country harder than everywhere else. From 1999 to 2017, the death by overdose of opioids increased 519% in Indian country. That coupled with the fact that when the public health infrastructure in the United States was being built, like you have your state public health authority, you have your county public health authority, those have been built over decades. Lots of investment have gone into that infrastructure. That investment did not happen in Indian country. So those consumer protections that are assumed in every other walk of American reality, they are not necessarily a reality in Indian country. So for people to become involved in this, one of the best ways they could be involved is if Congress would actually fully fund the Indian Health Service, so that when you have a very painful injury, if the money isn't there to take care of you, you're not prescribed a painkiller to hold the line for you until care is available. That would help people get the care that they need when they need it and alleviate any mitigating circumstances where these kind of drugs might be prescribed. But I think also elders protecting their prescriptions, ensuring that their prescriptions are not available to people who may visit their homes or other family members who may be attracted to having them. I think that's another way to help. I think that socially and in policy, addressing some of the social determinants of health, poverty, and strengthening. One of the great ways that Native people can be involved with this is engaging in strengthening tradition and culture. Because health is not just about your body. Health is about your mind and your spirit also. And in our cultures, spirituality is key to our wellness. And what we've experienced historically has done a lot of separating us from our cultures. And we find that where culture is strengthened and culture is part of treatment, people recover more quickly, they recover for a longer period of time, and they have a better opportunity to be fully healthy.
Well, this is definitely an issue tribes across the country, including here in New Mexico, are working on. And thank you both for being here today to discuss this with us. Thank you.
Thank you, Miigwech.